Let's talk a second about kids. And so many of my patients now are in their 40s and 50s, so their kids are teenagers, young adults, even the real young ones too. I struggle with that a lot. So I always try and push the patient, their spouse, to tell the kids, at least using language that's appropriate for them. But you get a lot of mixed signals on that. So where do you feel? You think I'm right?
I think you're 100% right.
Cool.
Kids do so much better when they know what's going on and they feel included. They're part of the family. They want to feel included. Even a 2-year-old senses when something's not right with their mom, their dad, their grandparent. And so using language that's age appropriate can really just be so helpful in sharing your diagnosis. I always think too, it's so important to use the word cancer. That's a lot of times people say I'm sick, or mommy has a boo-boo, and so kids get sick and have boo-boos. And so you want to make sure that they know the right language, and that even if you don't have all the information, just starting to share with them slowly. And there's so many great resources for parents and family members and ways to talk to kids.
You know, we learned this lesson sort of the hard way ourselves. You've heard this story that my wife had breast cancer and our kids were 10 and 14. And on the day we found out, we sat down together and we used cancer, we used the words. But turns out we never actually went back and had a new debrief or update. And of course, we used language for 10 and 14-year-olds, and we never did it again when you're 17 and 20. And so our children now are like, I didn't know it was, so this need to kind of do it again as the children age, I think is something we learned.
Absolutely. And also checking in with kids. They might not have any questions at first, but that doesn't mean questions won't come about. And just checking in, do you have any questions? Just want to know how you're feeling, because sometimes the kids are looking to the adults.
Yeah, pre-COVID, we would invite kids to come to clinic, particularly during summer. And many parents would take us up on that. So anybody listening in, if you think that might be helpful for your kid, it's not inappropriate to bring a kid along to go with you to clinic and kind of see what it is you're doing when you're going away on every 2 weeks.
Wonderful.
Yeah.
Yeah. It's less scary than what they're envisioning in their minds.